maseneta.
Swiftly moving away from politics, the Ministry of Health has raised an alert of an outbreak of yellow fever in some parts of Marsabit County. According to the ministry, the first case was detected on the 12th of January this year in Merti and Garbatula sub-counties in Isiolo County. 3 people have already succumbed after contracting the disease, and as our health and science reporter Chebet Birir reports, 15 people have so far contracted the disease.
The Ministry of Health plans to conduct a yellow fever vaccination campaign after an outbreak was announced in a letter to media houses dated 3rd March. The letter that was addressed to all county directors for health indicates that the first cases were confirmed in Merti and Garbatula in the northern Isiolo County. 3 people have died from the disease, while 15 people have presented symptoms. The youngest patient is 11 years old, while the oldest is 65 years of age. The Ministry of Health in the letter emphasizes that majority of the patients are young adults, while men are the most affected. An alert has been raised in all the 47 counties as the emphasis is put on the high-risk counties, which include Wajir, Garissa, Marsabit, Meru, Samburu, Baringo, Elgeyo Marakwet, West Pokot, Turkana, Tana River, and Baringo. The high-risk counties have been advised to implement response prevention activities as the national government and partners mobilize resources. According to the World Health Organization, yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes of the Aedes species. The yellow in the name refers to jaundice that affects some patients. Jaundice is a condition in which the skin, whites of the eyes, and mucous membranes turn yellow because of a high level of bilirubin, a yellow-orange bile pigment. A small portion of patients who contract the virus develop severe symptoms, and approximately half of them die within 7 to 10 days. Large epidemics of yellow fever occur when infected people travel to heavily populated areas with high mosquito density and where most people have little or no immunity due to lack of vaccination. There is no specific treatment for the disease, but experts say that treating dehydration, liver, kidney failure, and fever improves the severity of the disease. Associated bacterial infections can be treated with antibiotics. The major symptoms of yellow fever include joint and muscle pain, fever, headache, nausea and vomiting, loss of appetite, and backache. The symptoms may disappear after 3 to 4 days. Experts also say that yellow fever is hard to diagnose unless they use PCR testing in blood and urine. This is because it is often confused with severe malaria. Vaccination is therefore the most efficient way of preventing the disease. However, there is a group of people that is not eligible for yellow fever vaccination. They include infants who are less than 9 months old, people with severe allergies to egg protein, and those with severe immune deficiency due to symptomatic HIV or other causes. Expectant women are also excluded from yellow fever vaccination, except during a yellow fever outbreak when the risk of infection is high. The first outbreak of yellow fever in Kenya occurred from mid-1992 through to March 1993 in the Kerio Valley, where a total of 72 cases were subsequently reported. Chebet Birir, KTN News, Nairobi.
We take another short commercial break. When we come back, I'll be telling you why disability is truly not inability.